Trust Your Gut Part 1. Yeah, fantastic. Thanks so much, everybody, for joining me today. It's a true pleasure to welcome you on this course because I have put everything into this and I'm super, super excited to share my knowledge with you and help you on your gut health journeys. So I would love for this process to be as interactive as possible because I want you to benefit as much as you can because this is about your gut health journey. And I am fully committed to helping you through whatever symptoms you have. There's no silly questions. So if you feel that you want to ask something, feel free to pop it in the chat box or just raise your hand. And I'd love for this to be a discussion rather than me teaching and like lecturing and then having questions later, because you might forget the question later on. I'd rather it to be a very interactive process. So ask me at any time if it's relevant to the topic we're talking about at the moment. Feel free. Okay. So, why trust your guts? Have you guys been on? I've been judging upon what I've seen on your forums and our discussions on one-to-one DMs. It's been quite clear that you've been on your own gut health journeys, tried different things, had these symptoms for a various amount of time, and struggled with getting to the root cause, right? Could you guys maybe give me a show of hands if it's been for like more than a year? Yeah, or even pop in the chat box if you want to call. So basically, most of us have had gut health issues for a long time, and let me know what you've tried in the chat box, and I'll throw a few of those out. The reason why I'm teaching you to trust your gut is because I don't believe that the body makes mistakes. I believe that the body only reacts to environmental triggers. Any inflammatory triggers from food or maybe stress might be exacerbating your gut health issues. There might even be an overgrowth of bacteria that's causing your IBS, and that's not being solved properly. So all of these symptoms that you're getting, whether it's bloating, constipation, acid reflux, indigestion, maybe abdominal pain, which is like causing you a lot of upset, they're all important because it's your body's way of telling you there's something wrong. And I don't think we should ignore them. Unfortunately, with the conventional healthcare system, often the treatment would be to mask those symptoms. So have you guys taken things like Buscopan to stop for pain, Imodium to stop diarrhea, or maybe even laxatives to stop reduce your constipation, or PPIs for acid reflux? There's loads of things that are out there that help us manage the symptoms, but actually don't help you resolve the root cause. So that's what I'm here to do. So a little bit about me, if you don't know already. I am a nutritional therapist, a little bit different from a nutritionist and a bit different from a dietitian. Now, nutritional therapists, there are thousands and thousands of us in the UK. It's kind of like a UK specific profession because I don't think it exists elsewhere because it was coined by a famous nutritionist in the UK. In other countries, the same title is similar to like naturopaths and functional medicine practitioners. So the reason why I'm a bit different to the other two professions is because I work through root causes, and I work to connect the dots between the whole parts of the body. So, for example, instead of going to your heart doctor for heart problems, I look at the whole body to understand why you have heart problems in the first place, right? So that's me in a nutshell. In my own journey, I actually have had IBS for a long time. I had IBS since I was about 21, and now 10 years on, I pretty much don't have a problem with it. Sometimes there are triggers, such as processed foods, maybe really inflammatory oils, and when you go out for a meal and they use a lot of oily oils in their cooking, that kind of triggers me. But in general, I can eat bread, I can eat sourdough, no problem. Dairy usually is no problem. And whereas about 10 years ago, those sorts of foods would really, really trouble me. So I've been through a lot. Along with that, I've had hormone issues like low progesterone, um, anxiety, insomnia, recurrent thrush. I used to have Raynaud's syndrome since I was 15 years old and barely ever get there anymore. It's where your fingers go numb during the cold or maybe when you're stressed. If anyone has that as well, let me know. And I had low energy as well, especially when I worked. Very much in a very fast-paced environment, and ironically in a health clinic. Jasmine will let you know how stressful that had been. So yeah, although that was a very stressful time, working in that way allowed me to learn so much in a space where so many people were so, a lot of clients were very sick, so learned lots of cases. So anyway, enough about me. Functional medicine is what I practice. So it's a method of treating someone as an individual, looking at all of the different factors in their health. And that can span from your life history. So whatever had happened in your life, maybe during your development, or maybe stressful events during your 20s, or if you're still in your 20s, anything that has caused you a lot of stress, maybe a breakup or a loss of a loved one, anything that has caused you difficulties and maybe played a part in your health outcome now. That's everything I want to know, alongside your current diet, things like that. Any lifestyle factors, lack of sleep, things like that. I want to know absolutely everything so that I can give you the best sort of support. So that's how I work. Okay. So the functional medicine model, as very, very briefly, when I look at someone's health profile, I don't just look at the symptoms at the top of the tree, because that would be your gut issues, that would be your acid reflux, that would be the depression or anxiety and low moods, right? But beneath that, you can identify things like body system imbalances. Maybe there's going to be metabolic issues, maybe blood sugar imbalances and hormone issues. Maybe you've got a gut bacterial overgrowth that's causing your bloating and gas production, which we'll go into in far more detail later. And looking at the root causes of that could be not chewing properly, or not nourishing your body well, or maybe not resolving any trauma the trauma that you've been through previously, or maybe even genetics is causing an issue. So that's the level of depth that I work towards. And the fact that health is dynamic is a message I wanted to give to you guys, because I think a lot of the messaging in healthcare is that, oh, you've got this, therefore you might have it for life, right? Have any of you been to your doctor or GP about your IBS or digestive issues? Yeah. And what did they say? Did they say anything? Did they say that you might have to be on medication for ages, or you just have to manage it or deal with it? Anybody get a response like that?
Yeah, they tell you to keep a food diary and then try like just removing certain items and seeing how it goes. But I'm just really bad at that. Like I can't
Yeah.
tell what it is that's made the difference, but it's usually just
Mm,
food diary.
yeah. And if you did follow that, did you see any changes, any improvements at all?
No, not really.
Okay. Yeah. So I do find that blanket recommendations like that don't tend to work that well, because firstly, you don't know why you're doing it, really, right? They're not really showing you why removing that food or keeping a food diary is going to help. And also, sometimes it's not even the food. Sometimes it's actually you, because I always say that it's not the food that is the problem. It's usually your ability to digest it and absorb it that's the problem. Yes, we have foods in the environment, and from our environment that's quite can be inflammatory. So if you were to eat a McDonald's, I don't know about you, but McDonald's does not agree with me at all. If you were to eat McDonald's, which is ultra processed, what would that do for you? Clearly, that's a very inflammatory food. But there are so many other foods in our society that you might not know is inflammatory, and you might be eating that on a daily basis. For example, oat milk. We'll go into that. So there's always something that we can do. before you even have to resort to medication, surgery, or whatever, there's always something that we can do on a natural level, on a lifestyle basis, diet basis, before you even go to drastic methods. And I think that's really important, to not go straight to medication, because it could be as simple as chewing a food bar. So it's time to own your own gut. So as I said before, your symptoms are your body's way of telling you that there's something wrong. So this whole process, these next 3 weeks, the process is to help you figure out what it might be. And you're not in this alone at all. I've designed the workbooks to help guide you through the process, which actually on the Practice Better app, on module section 1, part 1, there is a workbook which you are more than welcome to fill in as we go along today. And I've put the questions in as like a questionnaire type of thing. And it'll be asking you about like your bowel movements, like whether you get any acid reflux, things like that. And it'll make sense as we go along. So feel free to fill that in if you like, or you can do it at the end if it's too distracting. Okay, so symptoms of inflammation in the guts can be bad breath, because the digestive system starts from the mouth and then ends at your anus, right? When I say guts, I use that interchangeably with the digestive system. What I mean is the digestive system from top to bottom. So it starts from the mouth, and we'll go into that in more detail. You can get things like acid reflux or indigestion, gastritis, abdominal pain, bloating, SIBO, which is basically bacterial overgrowth or fungal overgrowth, leaky gut, constipation, diarrhea, loose stools, inflammatory bowel disease. Can I get a little bit of a show of hands of how many people have these symptoms on here, or maybe more? Yeah. So these are quite common symptoms. Okay, cool. Yeah, these are not really common symptoms. I hope no one's got inflammatory bowel disease. Anyone got inflammatory bowel disease at all? No? Okay, good. Good. Yeah, so inflammatory bowel disease can be really, really, really severe and quite hard to manage, but fantastic. So we won't go into that in too much depth. Okay. Oops. Right. So the aim of today, we're going to be going through the fundamentals of your gut and digestive system so that we can actually understand what's going wrong at each stage. So because if I think Elise just said that she's got acid reflux, understanding why that's happening and understanding the structures of your digestive system is really key, I believe, because it helps us understand where the problem is and how we can solve it. So feel free to let me know any questions as we go along. And yeah, feel free to fill in that workbook. And also, if at any point you share any details on your Instagram, TikTok, or whatever, feel free to tag me. I'd love to share it with the world. So the digestive system. Hippocrates is a famous physician from, he said that all disease starts in the gut about 2,500 years ago. And he's very much right, because if you cannot break down and absorb your foods properly through your gut lining, every single process in your body will suffer, because all the biochemical processes that happen in your body are dependent on the nutrients that you give your body. So there's this narrative that has been apparent for many years, is that nutrition is only something that's to do with... Sorry, is someone saying something? Have I got someone? No? Okay, cool. So there's this narrative that nutrition is usually used for weight loss and for your aesthetics. Nutrition is far more than just that. It is so important, because nutrition feeds every single cell in your body. I'm sure you guys know, if you eat a very poor diet, a very standard Western diet, then your outcomes are going to be a lot worse than someone who's got a healthy diet, right? And that's why you're all here, to learn what's healthy for you, right? So making sure that your absorption of nutrients, breakdown of nutrients is super important. And that's what we're here to do, get your gut absorbing, breaking down, absorbing the nutrients properly so that you can do everything else well. So before we get started on the digestive system, the gut-brain connection. Has anybody heard about the gut-brain connection? No?
Yes.
Yeah, okay. Some of us have, some of us haven't. Okay. Fab. So the gut-brain connection, there is a vagus nerve. The vagus nerve connects basically your brain to most of your autonomic digestive organs, even including your digestive system. You don't have to think about it. It just does it. You're just hungry when you're hungry. Your heart beats faster when you're scared, or you breathe heavier when you're needing to do exercise, right? You just do it. Same with your digestive system. It digests for you and you don't have to think about it. However, when we talk about the gut-brain connection, there's so much link between your mind and your brain. How many of you get stressed, and does that affect your digestion? Yeah, I'm seeing some heads nodded. Okay, great. So if you get stressed, what happens is your body goes into a fight or flight mode, right? So have you guys heard of fight or flight and rest and digest? The two sides, right? So it's basically your sympathetic nervous system and parasympathetic. They're kind of like on a seesaw. And when you are more dominant in one side, say, for example, your fight or flight, then your rest and digest kind of takes a back seat for a bit, right? So if you are stressed and you're at work, you're trying to complete a million tasks, if you've got kids or pets or whatever that's like, on your mind as well, making your life quite busy at the time, your fight or flight mode is going to be dominant, right? So how are you supposed to digest properly in that moment? How many of us are actually taking our lunch breaks in between meetings, scoffing our foods down, and not being able to digest our foods properly? It is so, so common. And we're going to look into how much we chew as well, which is super important. It is more important than people realize to take time to eat in a calm manner than people realize. We have stopped eating like humans, I always say, because we are not gathering around the fire, not enjoying the meal slowly with our friends and family. We're no longer doing that. We're doom scrolling on Instagram. We're watching TV whilst we're eating, or maybe like working through our lunch. And it's not allowing us to slow down and let our digestive system work. So that's why the gut-brain connection is so important. So I'd like you to keep that in mind whilst we go through these slides. Okay. So top to bottom. So we're going to go to the mouth first. So as you can see, the digestive system is pretty long. It starts from your mouth, through it down to your esophagus, your stomach. That's where your food sits for 40 minutes to an hour to 2 hours even, sometimes even longer. You've got your liver and gallbladder where you make your bile. You've got your pancreas, which makes your pancreatic enzymes to help you break down your foods even further. The small intestine is where you break down your foods even further and then absorb it into your bloodstream. It's also where 75% of your immune system is. So that's why, which we'll go into in a bit more detail, that's why your immune system, any immune issues are so, so closely linked to the digestive system. If anyone has any immune issues like asthma, hay fever, eczema, skin issues, psoriasis, autoimmunity, like diseases like autoimmune thyroid, diabetes, anything that is autoimmune driven, I would always look at the gut first. And then, of course, your large intestine when your stool gets formed, and then anus, where you defecate. Right, okay. So it all starts in the mouth. They say it starts in the gut, but I say it starts in the mouth because you have to chew. Who rushes their food? Yep. A lot of people do, actually. I rarely find that anyone actually eats quite slow enough. Like, even if you think you're eating slow, sometimes you just chew like 10 times and then swallow. Actually, we should be chewing about at least 20 times, like literally chewing 20 times. I chew about 30 times, and people who eat with me get a bit irritated with me. My partner might agree. But yeah, I eat very slowly because I know it helps my gut health. I used to rush my food too, and I realized, hang on a minute, that's like making me feel really rubbish. It's giving me indigestion. I can't break it down. I used to get a bit of heartburn actually whenever I was maybe starving for a meal, and then I'll gobble it all up really fast, and then I'll be like, oh, that really hurts. And I'd have to use something like bicarbonate soda or like antacids to calm it down. Since chewing slowly and taking my time, I don't get acid reflux at all. So the mouth is so important for digestion. Because if you don't chew properly, how is the rest of the digestive system supposed to do its job properly? If you, I don't know if you guys have seen this dude on Instagram or TikTok. There's this guy who literally has been biting his food and swallowing it whole. It went viral on socials recently, and I was just like, what are you doing? It's hilarious, but that's the thing he could do. That's the dumbest thing that anyone could do if they do try to do that. Because if you just bite that food and take it down into your stomach, your stomach's going to have a hard time breaking that down, and not to mention your small intestine. Imagine how that food is going to what that food is going to cause when it reaches your small intestine. I imagine bloating, of course, intense abdominal pain, a lot of gas, maybe even constipation, because your body's just going to be like, what the hell is this? How am I supposed to deal with this big lump of food? It can't break it down. So we have to chew, 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 and get your food into a mush before you swallow it as best as you can, because that helps your stomach acid break it down and make it into more of a mush. And then when it reaches your small intestine, your food has got to be nice and microscopic, because that's the only way it's going to be absorbed, right? If not, it just stays around in your gut and causes problems. So, and also back on the topic of eating like a human, if you are, most of us, I mean, a lot of us do cook still, but many of the times we rely on things like convenience foods, or maybe going out to eat, or using shortcuts. When back in the day, a lot of people would do slow cooking, be in the kitchen for a long time, smelling the foods, tasting foods, and getting your brain ready for digestion. That's smelling the food. I can smell my dinner in the oven at the moment. That helps to prepare my brain to send signals to my gut to start making those nice digestive enzymes, those stomach acids to help me break down that food, right? If we go straight from hungry to eating straight away, it doesn't really give us enough time to activate that rest and digest function, right? So taking your time is really important. I know it's sometimes easier said than done, because like a lot of us are in a rush, but maybe taking that extra time, blocking time out for your lunch break rather than allowing people to put in meetings in your diary is really, really important. So the oral microbiome, I love the oral microbiome. So do you guys know very much about bacteria? Bacteria, the yeasts and parasites and things like that. No? So basically, on our bodies and in our bodies, we have trillions and trillions of microbes, like bacteria. Do you remember? I don't know if any of you remember, but there was a TV ad when I was young, and it was the Yakult advert for that Yakult drink. I don't know if anyone likes that because I love it. I love it. It's my guilty pleasure. But anyway, the dude on the TV ad was just like bacteria, and that was the first time I think that people started to pay attention to bacteria because back then in the 90s, we were all like terrified of bacteria. We were sanitizing everything. I mean, most of us still do. We were spraying everything, detailing everything, and killing everything inside because God forbid we get any like food poisoning or whatever. And there's bacteria all over us. We're basically symbiotic beings. We live with this bacteria and we benefit them whilst they benefit us because they help break down nutrients for us. They help train your immune system. They help your immune system defend itself against bad bacteria and viruses, and even also protects against problems like hay fever, eczema, skin issues, even autoimmune issues. So having a good balance of bacteria is really important. And firstly, in your mouth, you've got bacteria in there. So of course, we brush our teeth hopefully twice a day. And when you wake up in the morning, you can feel that horrible gritty feeling, and you have to brush your teeth in order to get rid of it, right? And that's brushing all of that bacterial biofilm off. Anyone who brushes their teeth after breakfast at all? Or before? Anyone, everybody brushes before? Amazing. Amazing. So it's so important to brush your teeth before breakfast because if you brush after, all of that bacteria that was just growing overnight just goes into your gut. So if you already have compromised gut issues and you're eating all the bacteria that has just kind of grown overnight, that's going to contribute to the bacteria in your guts. Now, I'm going to put my money on a lot of you having bacterial overgrowth in your gut at the moment because it's so common. And if you have bloating or constipation, loose stools, it's more than likely that your digestive system has an overgrowth or at least an imbalance of bacteria. So we are our task throughout this month and for the next coming months, because it's not always solved very quickly, is to balance your microbiome, right? And the first thing you can do is balance your oral microbiome. So just check, maybe later in the mirror, just stick your tongue out like that and check whether you have any white coatings on your tongue or any sore patches, any ulcers, anything that has come up, any bad breath as well. Are you prone to plaque and cavities and all of that? Dental health is really important, although the conventional dental industry, I think they focus on killing the bacteria too much rather than nurturing the oral microbiome. So yeah, making sure that's all nice and healthy is great. I've got a few tips on the left hand side. You'll have access to these slides later, so no worries if you can't take notes. Okay. Mouthwash is really bad for the oral microbiome, by the way, especially if it's Corsadil or like Listerine, because that sort of those sorts of mouthwashes are really really harsh and kill all your good bacteria as well as your bacteria. Your esophagus. Oh, so this is going to be really important for any of you with acid reflux, which is super common. And I feel like it's been more common lately post-COVID. Not sure if that is a long COVID symptom, but it does seem like it's been really, really common. I know Elise has acid reflux. Anyone else have acid reflux? I think Ollie does, but he'll be watching later. Yeah, Chloe. Okay, great. Oh yes, I remember you saying. Okay. So the esophagus. So that's where your throat basically, and it joins your mouth, larynx, and then down to your stomach. You can't really feel anything go down it. You can feel it in your mouth, and then once it goes into your esophagus, you can't feel it, and it goes into your stomach. So you have muscles either around your esophagus, so it pushes food down. That's why if you don't try it, but if you ate upside down, you'd still end up your foods would still end up in your stomach. So yeah, you have sphincters at the top of your esophagus and at the bottom just before it joins your stomach. So those are like closures, and if within a healthy digestive system, those would stay tightly closed. So you shouldn't get any acid reflux. Acid reflux is not normal, even though it's really common. You shouldn't be getting acid come back into your mouth or causing that burning feeling in the center of your chest. So they call it heartburn, because at the bottom of your esophagus, that's like kind of in the center of your chest even, where your solar plexus is. And that heartburn feeling is really unpleasant. So, okay. Right, so in the module section 2, I have a worksheet for you to do. It's called the bicarbonate of soda test, and basically we're going to test basically how much stomach acid you have. So feel free to do that in the next week, and I'll explain that in a bit more detail in a moment. So once we get to the stomach, yes, with the stomach, fantastic. So the reason why I'm going to give you that test is because we want to know how good your stomach acid levels are. Stomach acid is so important because it's what basically breaks down your proteins and fats and makes your food into a mush, basically, before it gets to your small intestine. The pH is so acidic that if you touched it, it would burn you. And luckily, the stomach has a protective lining, but your esophagus doesn't. That's why it burns when it actually creeps into your esophagus, right? Your food should really stay in your stomach for about 40 minutes, if you're lucky, sometimes up to 2 hours. If you're feeling indigestion and that your food is just stuck there, you probably have a slow stomach emptying time. So, and that will make you feel indigestion and bloating. And what triggers that burn? Sometimes it can be common, these foods, like on the right hand side, chocolate, spicy foods, and coffee. Does anyone get acid reflux when it comes to these types of foods? Yeah. Okay. So it can be due to those because those are quite acidic foods. But then also there are various reasons, stress being one of them. I think Elise, we were talking about stress being one of your main triggers, right? Being overweight. Sometimes people have the hiatus hernias, especially after being pregnant, because when you're pregnant, your baby basically pushes all your organs up, so that causes a hiatus hernia, and that can make things tricky when it comes to your stomach. Lazy sphincters, so the closure thing, getting a bit lazy, that can be triggered by certain foods like histamine containing foods, and we'll go into that in more detail. Bloating. If you have got bloating from your guts and there's lots of gas production, that can put upwards pressure onto your stomach and causing that sphincter to open, and that can cause you some acid reflux. Okay. And it could be low or high stomach acid. So that worksheet that I popped in the module, you can complete that over the next week. And basically you just put 1/4 of a teaspoon into water. As soon as you wake up, drink that and time how long it takes you to burp. I know Elise has already done this, so you can be exempt from doing this one. And then basically repeat that on for 5 days. And that will tell you whether you have roughly low or high stomach acid. It's not a totally conclusive test, but it can give us a good indicator. Okay. If you do have acid reflux, please do check in with me prior to doing that test so I can just guide you through that. Okay. So I'm going to gloss over this one quickly because it's not as important for the gut health issue, but the pancreas basically makes pancreatic enzymes to help you break down your foods. And then your liver and gallbladder, your liver makes you some bile and the gallbladder stores your bile, and then that helps you make emulsify your fats, basically. Any fatty foods, if you struggle with breaking down fatty foods and deep fried foods and you struggle with absorbing those and you get runny stools, for instance, it might be that you're not producing enough bile to bind that to help you absorb it into your bloodstream, basically. Okay. Right. The small intestine. So the intestines are so long that you can actually span the mass of a tennis court if you were to lay it all out, which is crazy, that it fits all in your gut. But basically it's all bunched in together because it's so important to be have the biggest surface area because you want to maximize absorption into your bloodstream. So you've got sausages and sausages in your gut, in your belly, and behind that wall will be your bloodstream, and that's where you put all your nutrients that you want. Anything else that we don't want, any of the fiber, any of the bacteria on your food, any of the debris, bits and bobs that you don't need, you just poop it out, and that goes through to your large intestine later. Okay. The small intestine is so important. I think for most of you, this will be the most profound part of the digestive system because especially if you have any bloating, you probably have small intestinal overgrowth of bacteria because you're not supposed to have too much bacteria in your small intestine. Most of it's supposed to be in the large intestine. When you have an overgrowth of bacteria is just basically crept up or maybe crept down from your mouth and decided to make your gut a home and makes too much gas because when it comes to breaking down your foods, the bacteria in your gut loves to ferment your food. So I don't know if you've ever tried eating things like artichokes, high fiber foods that will cause you a lot of bloating. It's because your bacteria loves to do that. And when they cause that fermentation process, it causes gas production. And that's what makes you bloat. All that gas being produced distends your belly and makes you feel really uncomfortable. Right. So on a microscopic level, this is what your small intestine actually looks like. Any food that's broken down has to be moved into your cells, maybe in between your cells or into your cells, and then through to your bloodstream. And it's supposed to be like this, nice and tightly packed, so that we can keep bacteria and parasites and virus out of your body. Sometimes we're not so lucky to have a really nice, tidy gut. Sometimes it can be a bit more leaky, which we'll go into next week when we have problems with the small intestine and problems with absorption. Okay. And that's where you start to get things like food sensitivities. You can start to get problems like skin problems, maybe brain fog, headaches, maybe even immune system problems as well. But we'll go into that in more detail. Your immune system is also based there because when your gut is basically your contact with the outside world. Everything that you ingest goes through this system, and your immune system's got to do passport control. It's got to find out whether there are any pesky bacteria, microbes, or anything that you don't want, any criminals that we just want to get rid of. And when you see that criminal, that bacteria that's going to cause you a problem, usually the case is that you might get abdominal pain, or you might get the urge to go to the toilet and you have diarrhea and it wants to flush everything out. That's what usually happens. But it is so important that the immune system there is tightly regulated and does its job properly. Okay. Large intestine. So this is where your stool is formed. I've got a question on the workbook. Some of you have already completed it, asking you what type of your stool is. So feel free to fill that in. This is where your stool is formed. That's where you put more water or take out water to help you form a stool. So I'd like you guys to just check on this and think about how your stool usually looks like. Is it like rabbit poo? Or is it lumpy? Or maybe even sausage shaped if you're lucky? Or do you get really loose stools and blobs, which are unpleasant too? So we need to understand whether you're constipated and you're eliminating far too slowly. If you're constipated, there are so many problems that come with that because you can get more bloated. you can get more toxins being produced in your guts and recirculating into your body, and that can cause inflammation in various ways. You can have poor liver detoxification that might be triggering that and leading to detoxification issues. You might even, if you have on the more loose side, the diarrhea side, then you might not be absorbing your nutrients properly. So, and that can cause nutrient deficiencies and malabsorption. Okay. So, does everybody hydrate properly? Do you drink a lot of water? Yeah. Good.
Tea count.
Sorry, tea.
Tea count.
It depends. If it's caffeinated, no.
Okay.
Because are you a serial tea drinker?
Yeah.
Yeah. I used to be as well. Now I drink herbal teas only. Sometimes a coffee, but coffee and tea, if it's caffeinated, basically caffeine is diuretic, so basically makes you urinate more. So essentially it doesn't count because it dehydrates you more. So no, I'm sad to say. So we must be hitting. Sorry, go on.
Sorry, I was going to say, what if I drink squash a lot? Is that okay? Because it's a tiny bit of squash and loads of water.
Yeah, squash is fine. Yeah, squash is no problem. Just be mindful whether it has any added sugar or if it has a lot of like artificial sugars as well. Funny thing is with artificial sugars like xylitol and aspartame, they can actually disrupt your gut microbiome and the bacteria that's in your gut. But yeah, there are loads of alternatives nowadays with like stevia or flavorings that are natural instead of squash. But yeah, that's totally fine. That's quite hydrating anyway. In the sense of just water, yeah, it's fine.
Cool.
Okay. So yeah, sometimes dehydration can cause constipation and rabbit poo stools, but also dehydration can also lead to loose stools too, which is contrary to popular belief. You'd think that if you drank too much water, you'd end up getting loose stools, right? But no, it actually causes an imbalance in your electrolyte balance, and that leads to poor form of your stools. So drinking more water is really important. That's actually my Achilles heel, and I'm not afraid to admit that. Drinking water, sometimes when I'm busy, I totally forget. So yeah, we're all human, I guess. Right. Next up, what's the time? We're making good time. Okay, keeping the large intestine healthy. How many of you have constipation? Yeah, one, Chloe, anyone else? I can't see everybody, which is, but anyway, feel free to type a message in the chat box. Okay, no constipation. Okay, right, so, oops. Okay, not too much constipation here, that's good. Usually I get a lot of constipation. So constipation counts if you don't pass a bowel movement daily. So if you go every other day, that still counts as constipation, by the way. Making sure that you can eliminate daily with no problems is so important, because basically it's like I did a video on it the other day. If you're not passing daily, it's like not taking your bins out for a week and your house just starts stinking. Really important to get your waste moving every day, because you make waste in your body yourself from doing things like exercising, or just literally living and breathing makes you make waste. So getting rid of whatever is in your body that needs to go is important, otherwise it can cause inflammation. Okay, so actually I find that people with chronic constipation for decades and decades will end up finding that you'll get more niggles and that will cause you health problems. And we'll go into this in more detail and see what sorts of health issues can come from it. But yeah, getting your gut moving is really key for long-term health, overall health, and everything working well. Okay. we will, when we do your nutrition protocol, so in the second part of this module, there is a nutrition protocol. Now, I've made this protocol with recommendations like eating more fiber, eating more vegetables, avoiding wheat, drinking more water, things like that. So there's a general list of things that really, really help cover good gut health. And I might need to tweak some of this for some of you because you all have different symptoms, right? So when we do our one-to-one sessions at the end, then we'll go into it in more detail. I'm gonna tailor your nutrition plan and lifestyle plan so that it works for you. And we're also going to be going into supplements as well. So yeah, and to see what we can improve. Okay, so of course, when we're looking at helping you form healthy stores, fiber is king. Making sure that we have fiber in your diet is really key. Most of us aren't really eating enough fiber, and that includes things like soluble fibers in your whole grains and oats, or chia seeds and fruits and soft fruits, things like that. Insoluble fiber like root vegetable skins, things like the stringy bits in your celery, you can't actually absorb that into your system and you have to just poop it out. But it helps because it helps form everything together and bulks it all together. So super easy. Okay. So in the nutrition protocol, there is a list of fiber examples so that you can use that to improve your store formation. And this is what I was talking about with Yakult. There is my favorite Yakult bottle, which doesn't work actually. Yakult's not really a very good drink for probiotics. And actually, I will make a note on probiotics. Do any of you take probiotics at the moment? Oops.
I think so. Is that I take what's it called? Kombucha?
Yeah, kombucha, yeah, fantastic. Do you find that it helps you?
When I remember to take it, yes. I feel like it does help with my digestion a bit. Like, I don't know,
Yeah.
digestion or like bloating.
Yeah. Okay, cool. So yeah, kombucha, for any of you that don't know, kombucha is basically a probiotic tea. It's made from fermenting this little weird SCOBY thing. I don't know if anyone's tried to make it. It kind of freaks me out. But anyway, leave it to the food companies. But it's quite great because it's like it tastes like fizzy soda basically, and it's delicious. But it's got all the goodness, and usually it doesn't have any added sugar in it. It's just natural sugar. So it's really tasty. I do know that Sainsbury's stock it and the brand is called Nextbar. Really tasty. So
Tesco,
basically,
Tesco do as well.
yeah, is that sorry, which one?
Oh, Tesco. They've
Tesco.
got a couple of brands of it now, yeah.
Yeah, amazing. I'm so glad that more suppliers are getting onto this and finding it as a healthy alternative to like fizzy drinks. So that's great. So having probiotics in like a yogurt drink or even yogurt itself or even kombucha can be helpful. Can be really helpful. It depends what type. And it depends on what stage of your gut health journey you're on. So firstly, be mindful of what sources of probiotics you're using. Sometimes things like Actimel or what's that brand? Activia, of Activia yogurt. There's like so much sugar in those, and that can really be conducive to your progress. So if your source of probiotics is good, then it's going to have more likelihood that it's going to benefit you. However, if you are one of the people who have a bacterial overgrowth, so cause too much bacteria in your guts, and which is causing you a lot of bloating, then having probiotics at this stage might not be helpful to you, because it's like, imagine if you had a garden. If you had a garden and you've got like loads of weeds, but you want to plant some flowers. If you try to plant those flowers whilst you've got weeds everywhere, those flowers won't survive, right? Really, you've got to do the weeding process, get rid of those weeds, nurture the soil, make sure the soil is healthy before you put the flowers in, and then the flowers can thrive. Same concept with probiotics. If you put probiotics in now, whilst you've got an overgrown gut microbiome, it can actually either cause you issues or it's just not going to stick, basically. I actually have a client who went to A&E from drinking Simprove. Have you guys heard of Simprove? It's like quite a high potency probiotic drink. And yeah, because basically I think with her digestive system, it's just too compromised. And having a high amount of bacteria in the form of a supplement was just too much for her system. Now, it's actually not natural to take supplements with high doses of bacteria, although it does help. It does help with some people, and I do recommend probiotics for certain people, but not everybody. Sometimes when you add too much bacteria in one go, like in these capsules, you get like billions and billions of bacteria in them. Like what, like 100 years, probably a couple of decades ago, we never had this sort of thing. It's not really natural for your body to get that much bacteria in one go. So caution has to be advised, and using it at the right time is really key. So yeah, but making sure that we nurture your microbiome at the right time with good probiotic drinks, good probiotic foods is really key. Okay. And the anus, the evacuation station, a lovely part of the body. So yeah, we all evacuate when we need to. If you have any constipation, hemorrhoids, I just wanted to make a touch on this because hemorrhoids is so common. I don't know if any of you have piles or hemorrhoids, and I'm going to put my hand up. I do have a hemorrhoid, and I have had it since I was young because I used to be constipated as well, and straining really, really hard, pushing so much pressure down to your the really delicate tissues around your anus is really hard on it. So it's like blowing a balloon when you're straining that hard. Feel free to raise your hand if you want to come for me, and so I know that everybody else also suffers from this problem. It's super common. No one actually talks about it because it's quite embarrassing. But it shouldn't be because it's just normal human biology. So hemorrhoids can be quite itchy, but they will go away after. Rectal itching also can be a sign of parasites, or bacterial overgrowth or yeast overgrowth. So it's good to note these symptoms because it gives us clues as to what actually is happening in that gut. Now, I run a lot of comprehensive stool tests with my one-to-one clients, and that gives us a lot of information. If any of you have done stool tests or any tests with your GP or gastroenterologist, you might have done things like colonoscopies, endoscopies, maybe a stool test to check for calprotectin and inflammation. I do these comprehensive stool tests because it can show me what bacteria is in there, whether there's any viruses, how well you're digesting your foods, whether there's any like leaky gut, which we'll talk about later, if there's any difficulty with fiber and things like that. So it gives us a wealth of information. Like if you can get access to more testing, I always think that knowledge is key with more data. So yeah. So I think that ends the whole thing. Yay. Wow, right on time. I surprised myself. Great. I hope you enjoyed that, and I wasn't going too fast, and that was all understandable. I hope you all got what I was saying, because sometimes I can get really into the science because I love science. But let me know. Any feedback is super, super appreciated. Any questions? Anybody that would like to present a question, ask me something specific to your own symptoms? I'm just going to look through the chat box as well. Elise, you said that you used to drink Simprove before you got severe acid reflux. Oh, that's interesting. Did you not have any acid reflux prior? Oh yeah, you clearly didn't. Yeah. Interesting. Because what happens is if you have too many bacteria or ingest too much bacteria when your body's not really ready for it and can't get rid of it properly, that can cause more bloating. Maybe the bloating is pushing upwards pressure towards your esophagus, and stomach, causing acid reflux. But who knows? We'll talk about that in more detail. Anybody with any questions? Oh, feel free. Hi, Elia. Feel free to ask a question.
Yeah, I don't know if it's really much of a question. I was just thinking because you obviously, I mean, personally for me, I'm not great at identifying triggers because it's always like, oh, well, it could be hormones, it could be because my period's due, it could be because of what I ate, or it could just be, I don't know, the weather. Like there's so many things. And so when, for example, the GP asked me to do wheat elimination or gluten elimination diet, I didn't because I can't give up bread. And I was like, I don't think that's my problem. But I was just thinking, like, is it worth starting, because you were talking a lot how digestion starts in the mouth. So is it worth sort of starting with like reviewing your sort of oral hygiene before you sort of move on? Like, do you think it's worth sort of, you mentioned like oil pulling and stuff, sort of trying that out and seeing how that goes? And I suppose you just have to really, as bad as as I am, have to keep a sort of diary of to see and what happens and how it goes.
Yeah, thanks for your question. That's a really good question, actually, because it is really hard to identify the foods that cause you issues. So firstly, there is a food diary on the app if you guys haven't seen already, and you can just log your foods and log your symptoms so it can help us understand what's happening. So there are triggers. So commonly, gluten, and I know a lot of people say gluten, and that's probably why your doctor said to remove gluten from your diet and see what happens. It is a really common trigger purely because of the way that gluten or like wheat-based products like bread are produced nowadays. Like we don't make bread in the way that our ancestors did. Where do you get your bread usually?
Well, I have switched to sourdough now.
Okay.
M&S have a nice sourdough. I've totally I've stopped with white bread. Like that used to be my like go-to. I've cut that out. So I'm trying to just stick to sourdough. But is that okay, or is it, when do you need to just attempt a no gluten diet and see how it impacts?
I would say it would be really helpful to just do about 2 or 3 weeks without any wheat, because that is like, there are tests for it, but the only real way to understand whether it's an issue for you is to cut it out completely and then reintroduce it later to see what happens. So what you can do I mean, it's not forever, because what we want to do is get your gut strong enough to be able to handle it. And we want to know whether it's a trigger anyway, right? So I always think it is worth doing an elimination diet, especially for wheat, because that is one of the really common triggers. We would have to check the ingredients on that sourdough bread, because supermarket sourdough still isn't always created properly. There are proper bakeries that make sourdough, and the way it should be made is with water, yeast, flour, and salt. That's it. You shouldn't have anything else. If you see any other ingredients in your bread other than things like, I don't know, oats or I don't know, seeds or something like that, just to make it taste good, then it's not proper bread, right? It's the way that it's made. It's currently made in a factory whereby the yeast that they use isn't like the heirloom yeast that they used to use in bakeries back in the day. Like there's, I don't know if you guys have tried Gale's bread or their San Francisco loaf. In San Francisco, they have a famous bakery that has been using the same yeast culture for hundreds, I think about 100 years. And that's what makes the sourdough so good and so probiotic and gut loving. It's the bread that we get from supermarkets that have been made in cold factories with poor like bacterial blends, and also maybe like bleached white flour that has been sprayed with pesticides. That sort of wheat is just not what our bodies are used to, what we recognize as food. The problem is with wheat, especially in the UK, America, it's all sprayed with really heavy pesticides and herbicides, and it just changes the structure of the protein. So your body doesn't really recognize it as well as it used to. So if you have like spelt flour, that might actually work better for you, spelt bread. But it's a case by case basis. But anyway, in a nutshell, I would definitely give it a go and cut it out for a couple of weeks and see if that is a real trigger, because it is helpful to know.
And how long do you recommend for an elimination diet? Because the doctor said like 6 weeks, which seems like forever.
Now let's cut that in half. Let's do 3 weeks, 2 or 3 weeks. Let's see if we can do that. In the nutrition protocol, it does have avoid wheat products. So if you guys would like to give it a go, try to avoid wheat-based products, and there's a list of foods to avoid. So that would be like bread, and you can swap this for gluten-free bread. I do know a lot of gluten-free brands have a lot of fillers and rubbish in them as well. So maybe whilst you're doing a gluten-free elimination, you can try the gluten-free breads. Maybe choose, there are some bakeries online that do minimally processed breads as well, or maybe cut it out completely, and that'll make your life easier for the next couple of weeks. Pasta has gluten in it, and you can swap that with things like buckwheat pasta. I find that works really well. Like I think Sainsbury's and Tesco do a buckwheat pasta, and it's actually quite good. Lentil pasta, cakes, of course, biscuits, cookies, pastries, all of those will have wheat in them. Any flatbreads as well, that will have wheat too. So yeah, I've got some substitutes for those sorts of foods. So if you want to give it a go, that's that. So yeah, give it a go, use the food diary, see how you feel, and then when you get to the end of the 3 weeks, I would say eat more than you would usually with wheat. Like eat, if you usually only have a slice of toast, have 2 slices of toast. And then when you reintroduce that, let's see what actually happens. If you get any adverse symptoms, then you'll know. Okay. Okay, cool. Hi, Chloe. Feel free to go ahead.
Thanks. Mine's a bit of a weird one. So I was told a couple of years ago to stop having anything whole wheat, because I was having really bad constipation leading to like a build up in my stomach, caused like fissure tear and stuff like that. So I had to go to hospital about it. But everyone that I talk to is like, why would you have to give up whole wheat? Because whole wheat's supposed to be better than having like white bread, white pasta and stuff like that.
So
I'm kind of
very
like
good question.
not sure like if it's helped or if it doesn't help. No, yes, I'm not sure if it's ever like made a difference or not.
Yeah. So whole wheat, that is a really good question, because it's like a misconception that whole wheat is actually better for us, but it's not. Wholemeal is still wheat at the end of the day. It's still heavily processed and refined. And it's still sprayed with a lot of pesticides. So firstly, it doesn't help you that much with your blood sugar balance or adding bulk to your stores, because it's like milled just the same way as white bread. Secondly, yeah, the structure of the protein is pretty bad anyway, so that can be quite inflammatory to the gut, especially if they're not using organic wheat. If they're using making the bread in factories again, and that can be a big issue. I think for most food, it's really down to how we're making food rather than what the food is, because I guarantee you, if we go back 100 years and we eat bread that we used to make, I don't think it would cause us half the problems that it does now. Or even some people go to Italy and don't have any issues with pizza or pasta. So yeah, I think the issue is with us in our Western countries and our Western ways.
Yeah, I think that makes sense. I do feel like everything's full of shit in a sense. Like it's not healthy the way it used to be. Like my mum always says that when she was growing up, no one had gut issues, and she says that it's like everyone seems to have something that they're intolerant to, or bloating, gas, IBS. Like everyone has it now.
Yeah, it's so common. It is so common. And I think it's like come down to actually our overuse of things like over antibiotics. Especially when I was growing up, like antibiotics used for like common colds and flus, and it was just like used for absolutely everything. And actually that's partly why my gut messed up in the first place. I had loads of antibiotics as a child. So yeah, some of you might have found the same, like when you have had like surgery or an infection, any issue that has caused you to need antibiotics for a long amount of time, or maybe more weeks than you usually would, that can cause caused imbalances in microbiome. Also over sanitation. I always think that, you know, our immune system is supposed to, from birth, trained itself to respond to microbes and bacteria in the best way. Because we systems to be trained properly and defend ourselves against like bacteria when it comes to food poisoning or even like bacterial infections on your skin, anybody having like reactions on your skin to certain things, that's basically your immune system causing a reaction. What other examples? Maybe even eating something like sushi, for instance. Eating raw fish for some people isn't doesn't cause them any issues, but for others it is like a no-go. So yeah, it really depends on how well your digestive system is set up with the microbiome. So yeah, hope that answers your question.
Yeah, it does. Thank you.
You're welcome. Okay, great. So if everybody has no questions left. So in the module, there will be a section for your nutrition protocols. So feel free to look through that. I've suggested to meet your sort of fiber guidelines for the on a daily basis. So take your time to try that. I've also suggested to make sure that you have dark green leafy vegetables with each meal so that we can support your detoxification processes. I've also suggested to ensure that you try some bone broth if you can, once a week maybe. You can get it from the shop nowadays, or online, or even on Amazon. I've also suggested to avoid wheat-based foods for a couple of weeks because being one of the main triggers, I'd love to see if anyone has a specific trigger to wheat. And also avoiding things like alcohol, because alcohol basically is a sterilizer and kills all your good bacteria. Hopefully being January, we can participate in dry January. No, shaking your head, Chloe.
I can't, not that I won't, I can't on the weekend because it's my friend's 30th birthday, but I stopped drinking wine because I felt like that was triggering my stomach. So if I drink, I just have like vodka and soda water. So I guess that's not as bad, is it?
It's not as bad actually. But still, vodka, if you were to use that to clean something, it's still killing bacteria, right? So yeah. I mean, feel free once the weekend is over, maybe try to avoid it for a couple of weeks and see how you feel.
Yeah, I can do that.
Yeah, cool. Yeah, so that avoiding alcohol, chewing properly, of course, and counting your chews. I'd like you guys to give it a go and chew about 30 to 40 times before you swallow. See how different you feel. It might take some time to get used to because we usually just chew on autopilot. And see how that feels. Think about the flavors, think about the textures of your food before you swallow, and that will help to support your rest and digest system. Also, stress management. Earlier today we had a lot of raised hands when it came to stress being a trigger. So making sure that you can activate your rest and digest system, and making sure that your nervous system is calm and in a safe place to digest, that's going to be key. have an analogy for that actually, because but back when we were cave people, if we had a saber-toothed tiger coming at us, right? And we kind of needed a toilet, but we're just not going to go because the saber-toothed tiger is imminently coming. We don't have time to let our digestive system do its job. We have to run and get the hell out of here, because pooping right now would basically cause you delay in survival. So basically our bodies work in the same way. It may not be a saber-toothed tiger now, it will probably be deadlines, exams, or maybe your manager harping down the phone saying that you need to meet a deadline or something, right? Our body perceives stress in the same way, and a lot of us haven't got those stress management techniques in place to help our bodies calm down. So really important. So on that nutrition protocol, nutrition lifestyle protocol, take your time to work through those. It will be overwhelming if you implement everything at once. Try one new thing each day if you can, or maybe a couple of new things a day, and see how you feel. And then there are a few worksheets, so that you'll find the bicarbonate of soda worksheet to help you figure out whether you have low or high stomach acid. There is also the beetroot worksheet, and that will be to help us see how fast your digestive system works and whether you absorb your nutrients well. We'll also do the sweet corn test, so that will show us how fast food moves down your gut and whether it's too slow, too fast, maybe just right. And then after that, there's a how you feel form for you to fill it in. I've also linked a example meal plan to show you what sorts of foods that I tend to recommend for people who have digestive issues, so that we can balance out your nutrient status. Okay. And that's it. So next week we're going to be live at 6 p.m. on Wednesday. So feel free to record. I have a sense of doom telling me that I haven't recorded this session. So in which case, if I haven't, then I'll have to record it again, which is no problem. But yeah, I'll have the recording available online for you to view. I hope you enjoyed that. I'll let you guys enjoy. It is recording, yeah, fantastic. That's great. Tech is not actually my forte, and I get really bad with tech. But anyway, I hope you really enjoyed that. Let me know if you have any feedback. Send me messages on the group chats. If you have any issues or any troubles with the app, let me know. If you want to message me directly, that's also cool as well. But I hope that was fun and interesting, and you learned a lot. Right. Have a good night, everybody. Lots of love. Speak to you next Wednesday at 6.
Thank
Bye.
you.
Thank you. Bye.
Bye. Thank you so much, everybody.